Hi everyone, this is Dr. Mamta Java, and in this video module I'm going to talk about a very important virus, that is Rubella virus. Okay, now guys, Rubella virus in textbooks, it is usually given in the chapter on myxoviruses, not because it's a myxovirus, but because of its similarity to measles virus in terms of clinical manifestations. Remember, in measles we have discussed that it's a febrile illness characterized by rash. Now, rubella also causes an amalgamation of fever and rash, but this rash lasts for 3 days only. All right. So, the disease which rubella virus causes, the disease name is rubella, also known as German measles or 3-day measles, because the rash lasts for 3 days. Okay. Now, as I said, rubella virus, it is not a paramyxovirus, but has got some similarities with the measles virus in terms of clinical features, as far as clinical features are concerned. If it is not a paramyxovirus, then what it is? It actually belongs to the family. It belongs to the family Togaviridae. But remember, it is not an arthropod-borne virus. It's not an arthropod-borne virus. Now, why am I saying so? Now, remember, we can make a note of this fact in this box. Make a note that the arboviruses, remember, arboviruses means what? Arthropod-borne viruses. So basically, there are some arthropods like, mosquitoes or ticks, which are going to pick up a virus from some animal reservoir. And when these mosquitoes or ticks, when they bite human beings, then the gift which we are going to get from them is the virus. So such virus which is coming via the agency of arthropods, they are known as arthropod-borne viruses. And arboviruses belong to actually, they come under 3 families. Remember, BTF, that is Bunyaviridae. This we are going to discuss later on. Okay, this whole topic of arboviruses: Bunyaviridae, Togaviridae, and Flaviviridae. All right. So these are basically the 3 categories of arboviruses, the 3 families. Now, Togaviridae has got rubella virus also, but rubella virus is not an arthropod-borne virus. Okay, not an arthropod-borne virus. That is why I told you the classification of arboviruses along with this aspect itself, along with rubella viruses. If not an arthropod-borne virus, despite the fact that it is a Togaviridae family member, then how is it transmitted to humans? Remember, the mode of infection of rubella virus is respiratory droplets. Respiratory droplets, and remember, transplacental. Okay, transplacentally. Okay, remember, this virus is an important cause of congenital malformations. Important cause of congenital malformations. All right, just like CMV. Now, I said it's an RNA virus, and what is the symmetry of the capsid and the genome? It is icosahedral symmetry, and remember, it's an enveloped virus. Enveloped virus it is. Now, when we are talking about envelope, we should know about the peplomers also. What important peplomer is there? This virus has got heme agglutinin peplomers. And unlike orthomyxoviruses and paramyxoviruses, the RNA genome is positive sense. Okay. Remember, ortho and paramyxoviruses have got negative sense, RNA. The meaning of positive and negative sense already has been explained in the video module on introduction to RNA viruses. Okay. So over here, the genome is positive sense. Now, I said that just like measles, this fellow is going to cause an illness characterized by fever and rash. And remember, in measles, I said the incubation period is 10 to 14 days. In this case, the incubation period is 14 to 21 days. So easy to remember. I hope. Measles 10 to 14, this is 14 to 21. Again, another revision, measles 10 to 14, mumps is 14 to 18. Remember, average incubation period in mumps was 19. All right. The range was 14 to 18, and this fellow is 14 to 21. Okay. So once the virus enters the body, then after this incubation period of 14 to 21 days, what will happen? The virus infects the upper respiratory tract and the regional lymph nodes, and then it enters the blood and goes to various tissues, all right, and it causes rash. Okay. Note a typical feature. In this case is posterior auricular lymphadenopathy. Okay, posterior auricular lymphadenopathy. All right. The rash, as I said, the rash is similar to measles rash. That is a maculopapular rash, appearing from top to bottom and disappearing in the same fashion. And the rash lasts for 3 days. 3 days. That is why it is called as 3-day measles. And remember, the basis of the rash is antibody-mediated vasculitis. And it can also cause arthralgia in adults, especially females than males. Okay. Now, guys, if this rubella infection is happening in immunocompetent individuals, right, nothing is going to happen. It's just a self-limiting illness characterized by fever and rash. So one attack is going to give lifelong immunity. Okay. So from that aspect, rubella virus is nothing to worry about actually. Why it is a worrisome virus is because this virus is a potential teratogen if it happens to infect pregnant ladies. Okay. Remember, this is a teratogenic virus. Okay. Pregnant females, if get infected in the first trimester of pregnancy, especially the first month during which organogenesis is going on, this viral infection can lead to congenital rubella syndrome. Or CRS. All right. Now this entity is characterized by a classic triad of, remember, heart defects, that is patent ductus arteriosus, which is most common. Okay. Less common is pulmonary artery stenosis, eye involvement, cataract most commonly, or glaucoma can occur also less commonly, and sensorineural hearing loss, that is deafness. Okay. Now the classic triad is, remember, PDA, cataract and deafness. Okay. So just remember a little memorizing tip. Dil laga ke andha behra hona. Heart manifestation, eye manifestation and deafness. Okay. So these are the features of congenital rubella syndrome. Plus also there is one more feature also going to be present, that is mental retardation. Okay. Mental retardation. All right. Now also to be noted over here is that the infected kids, when the infection occurs in utero, the kids who were infected in utero can continue to excrete the virus after they are born, and this kind of excretion of the virus by these kids, this can serve as a potential as an important public health hazard, because if pregnant females are around, they can get infected. Okay, so this can serve as an important public health hazard for pregnant ladies. Remember, we are more worried about pregnant females in whom, if infection occurs, it can lead to congenital anomalies in the fetus. But in other people, females who are not pregnant or other adults, it is going to be a self-limiting illness conferring lifelong immunity. Okay, so we are more worried about rubella virus because of its potential to cause congenital rubella syndrome. Okay, congenital rubella syndrome. Now, as far as guys diagnosis is concerned, culture. Remember, rubella virus itself produces rubella virus itself produces no cytopathic effect, but it interferes with the cytopathic effect produced by the echovirus. Okay, so therefore specimen, suppose we are specimen when added, specimen taken from the patient, let's say you're taking blood specimen when it is added to the cell line. Okay, if the specimen has got rubella virus, then you add the echovirus. Okay, you take the cell line first, inoculate it with the specimen of the patient in which you are suspecting the presence of rubella virus, and then you later on add echovirus. Okay, what will you see? No cytopathic effect of echovirus is produced because of the presence of rubella virus in the specimen. All right, so the cultures are not going to produce any cytopathic effect when they are super infected with echovirus. Okay, so remember this again. This is known as what? This is known as viral interference. This is one of the cytopathic. It's one of the methods by which you can detect the presence of virus in cell culture or tissue culture, and this belongs to CHIMT. Remember, CHIMT is a mnemonic which I mentioned in the video on introduction to viruses when I was discussing tissue culture or cell culture. Okay, right? So this is a classical example of one virus interfering with the cytopathic effect produced by another virus. Okay, then number 2, you can go for RT-PCR. It's an RNA virus. Then number 3, serum antibodies. Serum antibodies can be detected by ELISA or heme agglutination inhibition. Okay, remember, IgM antibodies indicate current infection, and also current infection is also indicated by fourfold increase in IgG antibodies also indicates current infection. So either a single a single result of IgM antibodies, you go for IgM ELISA and IgM antibodies are present, then it is current infection because IgM antibody is raised in current infection. But if suppose you have got an ELISA kit which detects IgG antibodies, then you have to take 2 separate samples, acute and convalescent serum samples, and you have to see whether there's a 4-fold increase in IgG titer or not. Okay, when you compare the ELISA results of both these samples, if there is 4-fold or more increase of IgG antibodies, then again your conclusion is going to be that it is current infection. All right. Okay. Also make a note of the fact that a pregnant lady, if has IgM antibodies, it obviously indicates acute or current infection. But if a titer of 1:8 or more of IgG antibodies is present, then it indicates past infection. Then there is nothing to worry about. Okay, this much titer 1:8 or more of IgG is indicative of past infection. Okay, past infection. Now guys, as far as vaccine is concerned, a live attenuated vaccine is available. Okay, the strain is RA273. Okay, there are not much side effects, except what? Except transient arthralgias. Because it's a live vaccine, it is contraindicated, CI contraindicated in immunocompromised people and in pregnant ladies. Alright, so guys, this is about rubella virus.